ex-president Nana Addo Dankwa Akufo Addo edi adesrede de ato NDC abanyanim se wasra omo se wo mumbo modern and complete agenda 111 hospital project or starting across the country want to me and we know. Now in fact sasem we are ex-president Akufo Addo akokan ase sebi wa kwako hwia eyemako ensema Ghana for titiama no social media no enyasem ketwa se uko under the comment section of this video and I'll share enkrofo one time video no aye ehun reactions na just say obia ni wo ka asempa fa president Akufo Addo obia ni wo ka asempa fa no anka at least ex-president de okofia anka sebiu enkrofo ebe kai wo kakraba ase president Akufo Addo de ko kasa na nkrofo tese astati to be man no enya asem ketwa moma yentie ensema ex-president Akufo Addo de tudwa. I have the video here me bo akire o me wi a na yakọ back akotie ebra na oye mampani a okọ kwa mesefa kan show so e wo Peace FM ye bisana about e-blocks President Mahama started when we were free office. One of the project ex-president Akufo Addo abandi abra no president Mahama e-blocks no wanye abra ye bisana e-blocks ho asem say Afloa Chief say wombra embeye bi no yentie nsamfu a ex-president Akufo Addo to money Afloa Chief ensema then time president na Peace FM kachira Afloa Chief about completion of e-blocks. Yentie ye wi ane akobo sa video na kai no. Ex-president Akufo Addo, your legacy will forever be in our heart. Ni odi ye no, ye refida. Yentie no na yenkwa kai ho quick.
Agenda 111 was designed to correct this imbalance by constructing district hospitals, regional hospitals for the newly created regions, specialized psychiatric facilities, and the rehabilitation of key health institutions across the country. It is a program that reflects a simple but powerful principle that no Ghanaian, regardless of location, should be denied access to quality health care. We must also be honest. Not every project was realized. Not every project was completed. Some facilities reached advanced stages but could not be finished before our term ended. Agenda 111 must be continued. Continuity, not disruption, is how health systems succeed. What was built must be maintained. What was started must be completed. What was learned must not be lost. That is how progress is ensured. A good indication of this is the completion of the Ghan and Uriche hospital projects inherited from the previous administrations of the first Mahama government and the Akufo governments by my government. It is noteworthy that recently, one of the most prominent traditional leaders in our country, the Ghanaian has had occasion to put this before the President of the Republic himself. The transition document submitted by the outgone MPP government to the incoming NDC government sets out in detail the various stages of completion of the active sites of the Agenda 111 project. We also embrace innovation as a tool for transformation. When we introduced medical drone delivery services, there were those who doubted its feasibility. That initiative has become a critical part of our healthcare supply chain, delivering millions of essential medical products, vaccines, blood and medicines to communities that would otherwise have been difficult to reach. Yet beyond policy and infrastructure, the true strength of our response lay in our people. This one, like many others, stood firm in the midst of the storm, not because it was untouched, but it was because it was anchored on a strong human foundation. The doctors, the nurses, the technicians, and the support staff rose to the occasion, often under immense pressure. They became the bridge that ensured that even in crisis, hope was not lost. If there are lessons we must carry forward as a nation, it is this: health is not partisan. Disease does not recognize political colors, and access to care must never depend on circumstance or privilege.
So this is Omampenyi Dada, ex-president Akufo Addo, Nenseminon, wa wisa burofo ne nyina. Nti ne o ka kire president John Mahama ne na ban nyina ne say wo mo complete agenda 111. You see? This is the man na oba power ye pa na cho say on complete sagleme keke sagleme. Wanye kojo pa nkruma be ye works and housing minister. Ere na omo ye fa ho. Na sagleme wo ho. Oman nya ne hwi. Later ye beti ya say ya ton me nim say no kura wo. E na omo san say omo kosi new housing project. Akwesi say under this and Akufo Addo regime, se wani afari ekaye yanye. Because it started by a certain government. Tiyebe yana abaina jihu credit diye yanye. They left it there. Yebe yama party biyabe jihu credit no yanye. They left it there. Enti tese e-blocks se kan wura mu no. Enye e-blocks ketwa. Wanye under mu regime or Konfanochi teaching hospital kura mu stronghold mo antiman CC ho. Ena mo say mo ko bie agenda mo ko si agenda 111. Hospitals are mo si ya na eze market mpatano. Agenda 111. Hospitals are mo si ya ubedru na empty room, no thermometer. Even panie kura para kura nim akonya kura nim empty rooms. Muka che se mo complete 10 se sen yo mu hand over na mo se mo complete 2 na mo se mo asini kura empty rooms hwi nim and then na hospital ya hospital enye equipment se wo o mu sisi nice in wem no so mo awie. Listen to Akufo Addo time we president ye be sound about e-blocks completion hwensem hunu o ka kire o hene no tie.
How about the e-blocks? Many of them. I think I'll find an opportunity to send you that many of them are being worked on across the country.
Let me just take one, Mr. President. The one in Afloa where the chief himself has complained. Afloa Patch say e-block no oba yenya hoshi. Inti my education minister up to February say oba yehu bibi. It's on
the minister ultimatum.
Also bre.
And over here.
Inti obisa no there every out of frustration ebi okasa.
When bia so no yeah boy hunia as much as possible. I've given you these examples to let you see that on the contrary, despite the propaganda, because one of the things that I suspect there's a deficit on our part is our ability to counter the propaganda. The propaganda takes over the reality of so many aspects of our national life. It's a pity, but we'll continue.
Is it not because you have a weak communications team?
I don't want to think of it. I think
you've been accused of that. Say yes. MPP more communication, you're poor, you're weak. You're doing good, but nobody's hearing about it.
But people are feeling it. The people in the various areas of life are feeling it, are responding to it.
Would you improve on your communications team?
What aspect of national life can you not improve? What aspect of political engagement can you not improve? You can improve it. But at the same time, too, virulent propaganda has its own power. And that is the phenomenon that might...
So, ex-President Akufo Addo, or say, catch the Kwame Sefa say, or catch or him say, and the Onuanko complete ye, or no neighbor minister ultimatum say, or may. It is a minister member ya or Nuango complete. After all this, no agenda after all this, no e-block beyond Akufo Addo complete. No e-block. I challenge any MPP communicator to come on air and tell me King Fantastic say e-block be okrumha express that Akufo Addo complete. No e-block. E-block say ombe 2 year na ewo ngure mu nyina say Mahama aba back no be complete aminim. Akufo Addo untouch she. One touch back. Not even single e-block. Catch the hen say, and your nunko, if you want to go listen to this place where.
How about the e-blocks? My education minister up to February say, "Oh, my young baby." It's on the set.
Oh no, minister. Ultimatum.
Also,
And you go here.
What's it? A president wasn't there. Say, oh, he say what brea and your own quiet. Listen, or say, Afloa he say, so I can a banyacha and your uncle complete and fan or he no and fan of quasi uncle complete. That was an insult to the chief of Afloa, a big insult. And Kwame Sefa kind no tissue so announce no Kwame Sefa kind of Revolta region ni kurom no. Kwame Sefa kind no interview Akufo Addo was show no. Kwame Sefa kind couldn't tell the president say, Mr. President, these words are too harsh. Kwame Sefa kind from Volta region no. Kwame Sefa kind man can't say President Akufo Addo say no because the president because now a MP, a board chairman, a board member. And Akufo Addo na Kwame Sefa kind no a MP, a board chairman say dey you. Nti won't mean can of crunch no. And our cancer hunu achire o hini na wa sorry. And we will complete it till date. Akufo Addo free office handing over note no and him fan o say ya e-block baby. Same man went to Kumasi and akwabiri for say omu kwan nye so omu abe yometu abatia no ka kire omu say omu for omu kwasi ankwa na omu ko promotini nya ne de omu ko to ama NDC a emfa no ho Akufo Addo ka kire kwabiri for say musi manya kwan na ama mo metu ama NDC ye mo asem mo fa mo kwasi ankwa to ma NDC member ye kwabiri kwan ye now anya kwasi ya opuro biti baby say we miss Akufo Addo, we miss Akufo Addo. You miss who? Where your president you miss no. So why Jimmy Abwadam Krama why I said yeah president be say arrogant man say already president. This type of arrogant president you miss no. Wo pese ye kan mu Akufo Addo niama o. Wo pese ye kan mu amamu fun kan Akufo Addo bebu ye be kan mu. Where your president are you missing? Now we see Addo show boy, Addo gaga, we miss you. Miss who? Obey then. Miss who? Who? Miss who? Huh? President and Nimsene ye krokro nipa. President, this same president, not election day, na yen interview with Hello FM. Now for Pankro Facha said they should go out and vote. On election day, na yen interview with phone call so no say phone call twaba. Nyaw no so be twama endis or mungo tuma endis no. Election day, then na election day he was on a phone call with Hello FM live on air. Catch that Nkrofo said they should go and vote. Musuno mo wi na ebo no. This is what he said about e-blocks. Same person to what they say, you complete agenda 111. E-blocks say no complete. Who complete Sagleme? Who complete Sewa? Who complete Afari? NDC project say you muja no wiye. I hope say you complete agenda 111 now once you do rebiano. Why? Ah? Mama my cancer mo. I'm very angry.